And the health sector is grappling with a serious shortage of nurses to take care of patients with chronic wounds, particularly cancer-related cases. From a recent statistic, the nurses are reported to be handling between 15 to 20 patients daily against the World Health Organization standards.
With a rising number of patients battling cancer across the country, amongst other chronic illness, there is a dire need to train and hire more nurses to contain the rising numbers against a shortfall of nurses. The call was made during the second national and regional conference of nurses who deal with patients suffering from chronic wounds, held at the Kenyatta University Teaching Referral Hospital.
Ostomy care can no longer be treated as an afterthought or a luxury.
The conference that brought together experts in the specialized field of chronic wound treatment from the country and beyond.
Imeanza juzi, lakini imeendelea haraka sana. Wanao ujuzi kama huu wanatakiwa katika nchi sana.
Kwa vile kulingana citizens wenye wako na sisi ni wachache, na ndio tunasema tukishukuru serikali kwa ile efforts wanafanya kuongeza wauguzi, tungewarai ya kwamba wajaribu kuandika wauguzi wengi ndio wauguzi hao waweze kushughulikia wananchi.
According to a recent statistic, Kenya faces a serious shortage of nurses in the field, with each handling between 15 to 20 patients daily, compared to World Health Organization recommendation of 1 to 6 patients.
Pia pesa itengwe ya kusaidia pia kuangalia viwanda ambazo zinaweza jengwa ili kuangalia hizi vitu vinatumiwa katika hii ujuzi ya kutengeneza wounds. Pia sana vitu ambazo tunaweza tumia hapa tumetengeneza sisi wa Kenya wenyewe, si vitu za kuleta kutoka nje. Kama research inaweza endea pande hiyo, isapotiwe, pesa iwekwe kwa research.
Apart from the hiring and training of nurses, the government has also been urged to allocate more resources towards the training of specialized nurses and local manufacture of work materials that are largely imported. Milia Kisienya, KTN.
Well, and